Imagine waking up with a terrible headache 3,000 years ago. You decide to visit a doctor, hoping for some medicine to make you feel better. But instead of reaching for a bottle of pills, the doctor studies the sky, examines you carefully, says a few prayers, and might even suggest drilling a small hole in your skull. Sounds unbelievable, right? Today, doctors have advanced technology, modern medicines, and years of scientific training. But ancient doctors had none of these things. Even so, they treated injuries, performed surgeries, and helped countless people survive. So what was it really like to be a doctor in ancient times? Let's travel back thousands of years and explore the fascinating, strange, and sometimes surprising world of ancient medicine. Becoming a doctor in ancient times was very different from today. There were no modern universities, no medical licenses, and certainly no online courses. In ancient Egypt, many doctors learned by studying medical scrolls filled with treatments, observations, and advice passed down through generations. Surprisingly, some doctors specialized in certain parts of the body. One doctor might focus on eye problems, another on teeth, and another on stomach illnesses. That's right, medical specialists existed more than 4,000 years ago. Imagine visiting a doctor for a sore foot and being told, "Sorry, you'll need to visit the foot doctor across town." Ancient Egyptian doctors were among the most advanced healers of their time. They knew how to treat broken bones, stitch wounds, and use natural remedies made from plants, herbs, garlic, and honey. In fact, honey was often applied to wounds because it helped prevent infections. Modern science later confirmed that honey really does have antibacterial properties. But Egyptian medicine wasn't based only on observation. Doctors also believed that many illnesses were connected to supernatural forces and evil spirits. As a result, treatments often combined practical medicine with magical rituals and spoken spells. To the Egyptians, medicine and magic worked together. One fascinating fact is that some of the oldest medical documents ever discovered come from ancient Egypt and are over 3,500 years old. Around 2,400 years ago, Greek doctors began transforming medicine in a new direction. One of the most famous was Hippocrates, often called the father of medicine. Before his time, many people believed diseases were punishments from gods. Hippocrates proposed something revolutionary. He suggested that illnesses had natural causes and should be studied through observation and reasoning. Doctors began carefully examining patients, recording symptoms, and looking for patterns. This approach helped lay the foundation for modern medicine. Many doctors today still follow a version of the Hippocratic Oath, a promise to practice medicine ethically. Of course, not all Greek medical ideas were correct. Hippocrates believed the body contained 4 important fluids: blood, phlegm, yellow bile, and black bile. He thought illness occurred when these fluids became unbalanced. The theory was wrong, but for its time, it was considered advanced medical thinking. The Romans adopted many Greek medical ideas and expanded on them. Because Rome had a massive army, doctors gained a great deal of experience treating injured soldiers. They became skilled at caring for wounds, fractures, and battlefield injuries. Roman military hospitals were surprisingly organized and included patient rooms, treatment areas, and medical equipment. The Romans also recognized that clean water and sanitation were important for health. They built aqueducts, public baths, and sewer systems that improved living conditions throughout their empire. Many Roman surgical instruments look surprisingly similar to tools still used by surgeons today. Now, imagine needing surgery thousands of years ago. There were no antibiotics, no modern anesthesia, and no sterile operating rooms. Yet ancient doctors still performed operations. They treated injuries, removed growths, repaired broken bones, and sometimes performed a procedure known as trepanation. Trepanation involved drilling or scraping a hole into the skull. Doctors believed it could relieve pressure after injuries or cure certain illnesses. As strange as it sounds, archaeologists have found skulls showing signs that many patients survived these procedures. Yes, people survived ancient brain surgery. Although it's safe to assume they hoped the doctor worked very, very quickly. Ancient doctors used a wide variety of remedies. Some were surprisingly effective. Honey helped protect wounds. Garlic was used to fight infections. Willow bark was used to relieve pain and contains compounds related to modern aspirin. However, not every treatment was a success. Some remedies included animal parts, unusual mixtures, and even crocodile dung. Without modern scientific testing, doctors often relied on tradition, observation, and trial and error. Sometimes their treatments worked remarkably well. Other times, not so much. So what was it really like to be a doctor in ancient times? It was a challenging job that required knowledge, experience, courage, and sometimes a little faith. Ancient doctors worked without modern technology, yet they managed to treat injuries, perform surgeries, create medicines, and record medical knowledge that would influence future generations. While some of their beliefs seem strange today, many of their discoveries helped build the foundations of modern healthcare. The next time you visit a doctor, remember how far medicine has come. Because thousands of years ago, your treatment might have involved herbs, magical spells, or in some cases, a hole drilled into your skull. And suddenly, waiting a few minutes in a modern doctor's office doesn't seem so bad after all.